My name is Madison Murphy, and I worked with my mentor, Peter Cody, at Ridgewood Emergency Services in Ridgewood, New Jersey. My project is titled #COVID-19. The novelty coronavirus, SARS-CoV-2, more commonly referred to as COVID-19, has transformed lifestyles in the mere 12 months it has run rampant around the world. From dining to travel to healthcare, components of our lives have been rearranged. Every other day, I find myself on social media looking at old high school friends gathering in groups of 10 to 15 people, going into the city and just having a good time with one another. I compare my winter break to theirs, my long hours spent wearing N95 masks, transporting patients to the hospital, wearing protective gowns and face shields, and more. I volunteered as an emergency medical technician, EMT, for the village of Ridgewood in New Jersey, responding to medical emergencies while providing pre-hospital transport care for patients alongside my mentor, Peter Cody, while taking necessary precautions against COVID-19. In the era of COVID-19, staff health is placed above patients. I am so accustomed to being the first one in the door and treating patients right away, but new changes in EMS challenge that part of me. Part of the new protocol is to screen patients at the door prior to EMS entry. Although just a few simple questions, it certainly delays patient access. At times, I struggled and contemplated if it was worth exposing myself and my family in order to get to my patient quickly. In the event that a patient is suspected of COVID-19, the delay to patient access is even longer. Extensive PPE, in addition to our daily N95 masks, gloves, and goggles, takes close to 15 minutes to appropriately put on. In EMT, I signed up to be in this role to be there for patients and to help them. I come off of shifts and my other job working in COVID testing just simply exhausted. I am tired of the N95. I am tired of delaying care to my patients who need it. I am tired of going onto social media and seeing countless young adults, people who call themselves my peers, out and about with little disregard for who their actions affect as cases continue to rise. Consequences of these actions extend beyond one person. All of the hospitals in my area do not permit visitors for patients over the age of 18, and only one visitor for minors. The only means of communication is a phone call, a luxury some patients cannot afford. I was dispatched to the home of an elderly couple, one of whom had severe shortness of breath. It was quite obvious that transport to the hospital would be necessary to get the patient the proper medication to correct respirations. The patient and spouse said quick goodbyes, but the fear in their eyes was evident. I tried my best to ease their minds, knowing that our hospitals try to be accommodating and keep their families in touch with one another. However, this was the last time my patient and spouse saw one another. My patient died in the hospital 4 hours later, alone. These decisions to live life as normal during a pandemic have consequences that supersede any of us. I was witness to their final goodbyes with no inclination that this would be the last time they saw one another face to face. Our patient was a victim of this pandemic. There is just no positive test result to prove it.